Equine Lymphangitis, a presentation by Ellie, Christie and Natalie Markey. What is equine lymphangitis? Equine lymphangitis is a very common condition presented as an inflammation and swelling in horses. There are three different types: sporadic, epizootic and ulcerative. Equine lymphangitis is also sometimes referred to as fat leg disease or pigeon fever. Equine lymphangitis has many different causes. In a case of sporadic lymphangitis, the infection is caught through a breakage in the skin. These sometimes small and inconspicuous wounds, when not properly cleaned, can allow infection into the lymphatic system and allow inflammation to spread up the leg. In a case of epizootic lymphangitis, the infection is caused by a fungus, Histoplasma farciginosum. This is found within the environment as mould, and although a rarer form of lymphangitis, this infection is still very much something to be aware of as a horse owner. The third type of lymphangitis in horses is ulcerative lymphangitis. Ulcerative lymphangitis is caused by infection with the bacteria Corynebacterium pseudotuberculosis. This kind of bacteria can live for up to 6 or more months within the environment. For example, the soil out in fields. This means that a horse turned out with an open wound in this environment is at risk of being infected. Within all forms of lymphangitis, the infection spreads from the lymphatics to the local lymph nodes and causes painful blockages. What does lymphangitis in horses look like? Horses with lymphangitis will have 1 or 2 swollen limbs, most commonly the hinds. However, it should be taken into account that a horse infected with lymphangitis will not display signs of swelling for 24 to 48 hours. Sometimes, lymphangitis will present itself as sores on the distal limb or even the chest area. Excessive sweating and pitting edema are other signs of infection. Pitting edema is a term for a swelling which, when pressed on, imprints of the hand or fingers are left upon the tissue. The effects of lymphangitis on horses. As fluid builds up within the leg due to blockages and swelling increases, fluid can begin to seep out of the leg through the most damaged areas of the skin. In serious cases, abscesses can appear on the internal organs. These abscesses can take months to heal, and due to the stresses of infection, horses can drop weight quickly or even colic. Limbs affected by lymphangitis may never return back to normal, and the swellings caused by the infection can lead to long-term lameness. Lymphangitis is also known to be recurrent, meaning that it is likely that a horse once affected by the disease will be affected again. How is lymphangitis in horses diagnosed? To ensure accurate diagnosis of lymphangitis, a veterinarian will sample the sores on the horse's limb. Tests will be carried out on said samples to identify the bacteria and organisms causing the infection. It is vital that the exact bacteria is identified so that the treatment is accurate and beneficial to the horse. Your veterinarian may take a blood test and an ultrasound to check for abscesses. The treatment and managing of a horse with lymphangitis. Horses affected by lymphangitis will require aggressive antibiotic treatment for around a month or longer and will require much care. Abscesses on the surface can be pierced and drained by a veterinarian and may also be treated with poultices, hot packs and flushing out with water, also referred to as hydrotherapy. If your veterinarian decides to pierce these external abscesses, iodine solution will be used to ensure the area is safe from infection. If abscesses are deep within the muscles, your veterinarian may use a drain to help relieve the pressure. Most commonly with lymphangitis, breakages within the skin will be left on the limbs due to infection. Your veterinarian may provide a daily scrubbing routine containing the use of shampoo infused with iodine used on the affected leg. It is important to remember that pain medication is essential in the early healing stages of lymphangitis as, if left without pain relief, your horse will most likely refuse to eat, move, or perform any of its required functions due to the pain it's experiencing. As always in recovery, the affected horse should not be turned out or stabled with healthy, unaffected horses. Successful treatment will mean a reduction in swelling, pain and discomfort. However, if left untreated, lymphangitis will become long-term. Unfortunately, if your horse develops internal abscesses due to lymphangitis, this can be fatal. 30 to 40% of horses who are affected by internal abscesses die due to the strain of the infection, even with the correct treatment. Lymphangitis can be a debilitating condition within horses and is hard to entirely prevent. However, through maintaining good hygiene, fly control, checking legs for wounds, and avoiding prolonged exposure of the horse to damp conditions, we can distance ourselves from the chance of our equines being infected by lymphangitis.